implement. And since we have a work plan which fits themselves, this is implement, and it's something we can take forward to do actual implementation within the different countries. And talking again of the situation we are in, I think COVID-19 and the situation, the lockdowns in the different countries has really rolled back some of the achievements that most partner states had made, especially in terms of child protection. You've heard of so many cases of child pregnancies, and so this child trafficking across the borders and any other harmful practices, which we hope that since we already have regional frameworks, probably we can work faster and be guided better to implement some of the policies together as a region. And on priority area 6, which relates to service provision, especially in the areas of education, health, and social protection, we have also seen great progress, and we have developed what we call the minimum standards for comprehensive services for children and young people in the EAC. And these minimum standards have also been adopted, and different countries at different levels in the domestication of these minimum standards. The minimum standards are also broad. They consider the development stages of a child and other issues that relate to the child growing up, especially cognitive, the physical, but also the emotional development, and suggest strategies in the different areas, including early childhood education and development, but also health provision across the different stages of life, including psychosocial support. So with help from Save the Children, RIAT, ESA, and REPSI, we have finalized this and printed, disseminated the minimum standards, conducted different learning forums with governments, but also with stakeholders. And in some countries, there have even been forums for domesticating the minimum standards as the overall or guidelines on service provision for children in the countries. So here we have also seen great achievement. Priority area 7 on child protection in conflict and emergency situations. This is also an area where we are in discussion, especially at continental level. We are engaging with the Committee of Experts on the Rights and Welfare of the Child, but also with support from the African Child Policy Forum to have a regional approach on conflict and emergency situations in collaboration with other sectors, especially the border management sectors, but also peace and security, defense, so that especially in the area of conflict, we address some of the issues of the long-standing conflicts in the region, which have seriously affected children, but also when it comes to emergencies, so that we are better prepared for emergency situations. An example again is the pandemic, which came and nearly caught all of us unawares, and we could see that, especially at regional level, that we didn't have a regional approach to respond to COVID-19, and maybe probably for children we can work better. So here we held a conference last year on children and conflict in Addis Ababa, and EAC made pledges on various areas which they will fast track together with other RECs and the African Union. So we hope that this is also an area which we can strongly take forward in the next implementation phase. And we hope that the study will also probably show the different gaps and challenges we are facing, so that we are better guided going forward. And that's the same with the next priority. Private sector. And related to this also, we had a conference in 2016, which was on investment in children, and it was a broad conference involving children from all partner states, and many recommendations were made, and some of these recommendations we need to review them and make sure that they are actualized so that they address some of the issues that were raised then. But we are also in plans to work with the different agencies in the interagency working group to also do a study on budgeting for child rights in the EAC, and maybe that will help us to develop a case for resourcing of child welfare services and institutions. On priority area 9, this is exactly what we are doing. We've developed a monitoring, evaluation, and reporting framework, which has informed and guided this study. And this is the first time we're actually using it, but we hope that we shall consistently use it to monitor actions relating to the child policy, but also to ensure that there is accountability and attribution of the different actions to the impacts that are realized at regional level and also at national level. So we hope that this framework, as it has suggested, that countries can report to different treaty bodies, including the EAC, but also the AU and the UN, to the different committees, and send these reports timely, but also involve the civil society to do alternative reports, or also contribute to these reports, and ensure that countries are doing it often, because the observation is that within the region, countries have failed to timely report and also adhere to the different reporting schedules. So we hope that we can encourage and ensure that countries are reporting, but also are reporting on the child policy, so that we get constant policy direction, but also programmatic action guided by the different evaluations from the utilization of this tool. So this tool is available. It has also been adopted and validated, and it's currently in use. Then priority area 10 on effective child participation. This is still an area of conversation at regional level, because as a region, we're standing between the continental and global levels, but also the partner states level. where we know that there are a lot of forums for engaging with children on the different different policies and legal mechanisms within the countries. So we are trying to have a discussion with the African Committee of Experts on the Rights and Welfare of the Child, and actually this was discussed at that level, and it was agreed that there should be a continental guideline on child participation. And for us as a region, we agreed that once we have these guidelines, continental guidelines, we shall contextualize them and have a strategy that seeks to effectively and meaningfully engage children in the region on the child policy, but also on the other issues regarding the EAC regional integration and the child rights issues in the different countries and regionally. So this is how far we've gone with the child policy at regional level. And I'll wait to hear from the government of Kenya, just to hear the perception and the reception of the child policy as a government, how far they have gone, the gaps and challenges they have faced, and how we can better move together in the next phase. So I'll stop here and hand over back to Yvonne for the rest of the program. Over. Thank you.
Thank you so much, Maurice, for such a comprehensive overview of where the EAC Secretariat places itself in terms of implementing the 10 policy priority areas. I note that there are some very pertinent questions coming from John Joka and Stephen Usembe, but I would like to request your indulgence, colleagues, to wait till we are at the end, and then we will respond to the various questions. So Maurice, in the meantime, you can also look into some of the questions that are coming, and then we'll tackle them during question and answer. So at this stage, I would like to also invite my colleague, Alfred, just to give us a brief overview of how we got to the draft report we currently are trying to beef up in terms of giving us an overview of the purpose and the methodology followed. So Alfred, over to you.
Thank you very much, Yvonne. Once again, welcome, colleagues. And I think as consultants, we will be failing if we didn't acknowledge the manner in which Kenya has responded to this review. I must report here that Kenya was the first country to be available for completion of the questionnaire that we sent out, both in terms of government and civil society. I'm aware, I think some of the colleagues that we interviewed are actually available with us on this webinar. I think I can see Madam Mogaka, Total News, and of course, Dr. John Njoka. And so I think I just want to say thank you very much. You have also already given us your feedback on the draft report. That's government that we sent out. And so thank you very much for that. Maurice, can you take us to the next slide to briefly, so that I can briefly just lay the ground for the purpose of this this review? Thank you very much. So without taking much time, this review had basically 6 objectives as projected on the slide. Basically, we asked you to examine the partner states' efforts, basically to align along the domestic laws and policies in line with the international instruments, and also we're supposed to assess implementation efforts, specifically looking at budget allocations, establishment of institutional structures, and the specialized workforce and services. Also we're supposed to analyze mechanisms for coordination, collaboration, and learning on the implementation process, as well as explore successes and challenges in institutionalization of the international child rights commitments. And also, as we all know, we are in the times of COVID, and this review was also tasked to review the impact of COVID-19 on the children specifically, and also on the partner states' response capacity. And also at the end of doing 1 to 5, this review, is intended to identify areas of action for partner states and the other stakeholders. What should be done to accelerate implementation of the child policy. In terms of the methodology, Maurice, can you go to the next slide? Basically, the methodology included literature review, which was basically based on Google research and the documents that we got from the various stakeholders. We also prepared a checklist that was circulated to all the partners at government and CSOs. I'm happy to report that I think quite a number of the government responded, and quite a number of CSOs also gave us the completed the checklist and sent it back to us. This webinar that we are conducting is also one of the methodologies that we're using still to get to the bottom of the matter in terms of trying to understand the progress made, the challenges, and what needs to be done moving forward. By way of methodology, I think we continue. I think from this, there will be other steps that will be taken. I will not delve into that. I think Maurice will do that. But suffice to say that I think this has been basically the methodology that has been followed. And again, being mindful of the times in which we are, these are the times of COVID, and so we had to do what we could in the context. In terms of the 3 main outcomes from this review, if you could take me to the next, Maurice. There were basically 3 main review outcomes as projected on this on your screen. To a report that establishes what partner states have achieved so far since the baseline, and as we all know, the baseline is 2016, and to identify successes, challenges, and the persistent gaps, and then as an outcome based on the findings, looking at priority actions, which is part of the report as in A. And then the COVID-19 analysis is intended to also serve as a baseline on the impact of the pandemic as we all move forward in these times. So those were basic outcomes and the methodology and the purpose for this review. I'm happy that we are available to continue on the methodology in terms of giving input to the process. So thank you very much. Yvonne, you want to take us forward?
Yes, thanks, Alfred, for that overview. We proceed with calling upon the government representative from Kenya, from the Department of Children's Services, to also give us their reflections on how the implementation of the EAC Child Policy is going on, and then we'll move on to the CSO. So, Mary, I would like to believe you are the one giving some reflections on government implementation. Over to you.
Hello, Yvonne, and all the participants.
Hi, Mary. Good afternoon.
Afternoon to you. So, on behalf of the government of Kenya, the Department of Children's Services, I want just to appreciate the EAC Secretariat for organizing this webinar. And just to briefly go through what we've done so far. I hope I'm audible. I don't know whether I'm able to share my screen because I saw the function had been disabled on my side.
Mary, perhaps you could share your presentation with Maurice, or Maurice, alternatively, you could provide some sharing rights to Mary.
Yes, let me do both. Sure. Let me share. Let me give her. Let me add her as a co-host so that you can share. But also, if she could also send the presentation. So you can now share
Sorry
the
for that.
presentation.
Okay.
Yeah.
Hello?
Yes, we can see it now.
You are able to see it?
Yes.
Okay, let me do the slideshow then. So thank you. So I will just run through the priority areas on what as a country we've done. Basically, area 1 on regional approach, we have ratified most of the child rights related international and regional instruments. That is the UN Convention on the Rights of the Child, the African Charter on the Rights and Welfare of the Child, the Convention of Elimination of All Forms of Discrimination Against Women, and the Convention on the Rights of Persons with Disabilities, among others. There are a few protocols that we are yet to ratify, but most of them are optional. Like we've not yet finalized the optional protocol on sale of children, child prostitution, and child pornography. But when you look at our laws, the Children Act and the Sexual Offences Act, you will find that the provisions in that protocol are already in our legislation. I don't know whether I'm the one with the noise. So priority area 2, on harmonization of national laws and policies to the African Charter, the Convention on the Rights of the Child, and other international child rights instruments. Our constitution, which we changed in 2010 as the whole article on children, that is Article 53, and now the best interest of the child is enshrined in the constitution. We've been able to harmonize most of the aspects of our laws and policies with regional and international child rights instruments. Some of these include the definition of a child. It's at 18 years, and it is in our constitution, Article 260. A minimum age of employment, minimum age of marriage, minimum age of sexual consent. We have a gap in a minimum age of criminal responsibility, which is currently at 8 years, but it has been recommended to be revised by international standards in the Children's Bill. Priority area 3 on right to citizenship and identity. Our constitution is that any child found in Kenya who is or appears to be 8 years is considered a Kenyan. So we give citizenship to children to 8 years. I know you will ask why. Birth registration is a national program, and it's a requirement to join a school and also to sit for national examinations at class 8 and form 4. But there's need to enhance public awareness on collection of birth certificates after registration, because we register children at birth, but we take time to collect. And it should be noted that registering a birth in Kenya does not confer citizenship. Priority area 4, I hope I'm audible. I'm not speaking to myself. Yvonne.
Yes, we can hear you.
You're speaking to all of us. Don't worry, Mary. Go ahead.
Yes.
Okay, thank you.
Yeah, we can hear you loud and clear.
Okay, thank you. So, priority area 4 is about addressing cross-border child rights violations, and the issues include child trafficking, FGM, child marriage, child sexual abuse and exploitation, among others. And this is an area that still requires a lot of work. We have started a collaboration with the government of Uganda on issues of trafficking in persons. And in most of our border towns and border points, you will find the officers working on both sides have a way of working together. But these initiatives require to be formalized so that we can say we are working together as the EAC. Priority area 5 on strengthening of the national child protection systems and community mechanisms within the EAC region. As a country, we've been strengthening for years now, guided by the framework for the national child protection system that we formulated in 2011. So we've been undertaking various activities towards strengthening the child protection system components. We recently undertook a second study on violence against children that we launched in July this year. And together with that, we developed a National Violence Against Children Prevention and Response Plan 2019-2023, whose main focus is on prevention. We want to prevent violence against children. So that plan has 6 priority areas, and 4 of them are on prevention, 2 are on response. Development, we've developed a curriculum for professional child protection workforce and hosted it at the Kenya School of Government. We are in the process, we've trained the TOTs, and we are in the process of now undertaking the trainings to professionalize the child protection workforce. And as a government, we work very closely with the civil society organizations in providing services to children. Priority area 6, an integrated approach to providing quality education, health, and social protection to children. We have specific, sector-specific plans, but we also have plans that bring all these sectors together. So the National Plan of Action for Children 2015-2022 encompasses issues of health, education, child protection, aspects of social protection. Then the Violence Against Children plan that I've just spoken about also is integrated, so it provides an integrated approach to issues of violence. And all these documents have a collaboration between the states and non-state actors in their development and in their implementation. 7, children in conflict and emergency situations. We have a national disaster coordination mechanism in place. Then our department, working with the partners in children in emergency situations subsector, is finalizing guidelines for child protection in emergencies. The civil society organizations in this call who are part of that maybe can comment that initiative. 8, resourcing of child welfare services and institutions. The budgets for child protection have been increasing over the years though they are still inadequate. And this is an area that is a bit difficult to measure because child protection is in different ministries and departments. So you really need to look at all the government ministries' budgets to see what really is allocated to child welfare services and the institutions that are in that sector. Number 9 priority area is the regional mechanism for monitoring, evaluation, and reporting of child rights. The EAC regional reporting framework, we require training for those who will use it and sensitization on its use for the others so that we can know exactly how to use it. I want to admit that we have not used it. But we have sector-specific indicators that we use to report on the work we are doing. And 10, on child participation, Kenya has been a lead in this area of child participation. We have our national child participation guidelines in place. We have children assemblies and child rights clubs. We have guidelines for the assemblies, and our children have been participating in a lot of legislative and policy development activities. They took part in the constitution making, in the review of the Children Act, in UNCRC and African Charter reporting, and in many, many other forums on issues related to their rights and welfare. It's an area that we also need to put more effort so that we empower our children to be able to participate fully in the community and in family and institutions like schools. Now I'm done with the priority areas and the progress we've done so far. You realize that I've just given a snapshot. There's a lot that we've done as a country, but I thought because of the time, I just pick the key issues. Now the challenges we have with the policy, it's about coordination of implementation at regional level. Then there is inadequate awareness on the existence of the EAC child policy and other documents. For us as a country, we've only done one sensitization forum on the child policy. And then issues of resources, generally for the sector, both financial and human, so that we can give services to children. The opportunities that I see at the EAC, I'm seeing political goodwill by the partner states. So that is an opportunity that we can use. Then the legislative and policy framework at both the regional and national level. We have very good laws and policies that we can implement, including the EAC child policy. Internet, that is now allowing us to even meet as we are doing now. It's well distributed in our country. So Total News will tell you that we've been able to have forums with children on the internet. And partnerships is another opportunity. both between the state and non-state actors, with donors, the UN agencies, the interagency working group. Actually, the sensitization that we undertook on the policy was facilitated by REPSI. So we have partners that can allow us to take this forward and also to enhance service delivery to children. So thank you very much. That's what I had for today. Thank you.
Thank you very much, Mary Goret, for the comprehensive overview of where we are as a state. I'm also seeing quite a number of questions around status of harmonization and also the ratification of certain instruments by the government of Kenya. But we will also delve into those questions during our question and answer. So I'd like also to call upon Jennifer Kaberi from Total News just to give us also a CSO perspective on how they see the implementation of the EAC policy in Kenya. So Jenny, over to you.
Thank you. Just give me a second. I need to go somewhere quieter. I was in a room sharing. Thank you so much, Yvonne and team for allowing this. I was told I'm going to speak about COVID-19 and the opportunities. So that's what I prepared. And I'm going to go through my presentation very quickly, but I will try to include some components of the EAC policy. Maurice, if you're able to enable my screen, I would really appreciate.
Instead of making Mary Goreta a co-host, I made her a host. So she now has the full control. Probably she needs to make me a host again.
Okay.
So you right-click on, so Mary Goreta, please right-click on my name, then look for more, and then make host. So that I'm a host again, then I can have the control.
Okay, very quickly.
Okay, thank you so much.
Thank you.
Yeah, so let me. Okay, so now you can share.
Thank you. I can still share. You've not made me a co-host.
And now?
Yes, I can share. Okay, just give me a second.
Okay.
So hi everyone, my name is Jennifer Kaberi. I work with Total News. We are a digital company that focuses on children. And during COVID-19, we've really seen the importance of digital and the work that we do in the digital space, just making sure that children's voices are heard. So my presentation is about the opportunities on COVID-19. So I'm going to present my presentation along the 4 pillars of child rights, and I'm going to say what the government of Kenya has done and what they have not done, and what are some of the opportunities that as civil society organization we saw and we have been able to take up. So on child protection, I'll commend the government. They closed schools fast, and I remember there was this thing that the government kept on saying: the right to educate, the right to life supersedes the right to education. And they kept on saying that when asked, why did you close school? And it kept on like the right to life supersedes the right to education. So they did that. They closed school to safeguard children's lives, which is a good thing. Development of child-friendly materials. I know DCS, Department of Children's Services, and the National Council for Children's Services, they developed some amazing materials for children to be able to understand what is COVID-19, how they can be able to safeguard themselves, issues to do with washing of hands and stuff like that. And they disseminated that both on digital and the printouts, and they posted them all over. Which another thing that I think I can commend the government is equipping the toll-free line. So as all of us know, with school closure and lockdown, there was a spike in child abuse. So because of that, the toll-free line was overburdened. And the government of Kenya, they actually went ahead and they equipped the 116, and by increasing the number of counselors, and now the counselors could work remotely. And I think they're still working remotely, if I'm not wrong. They're still working remotely, and they increased the numbers from 15 to 30, which is commendable. Today I was in a chat and someone said, call 116. I hope they've kept. And I had to tell them, just call them. Nowadays, at least you will not wait 100 children away for you to be picked. At least they decreased that number to 50. I think Madam Goretti has already mentioned the COVID-19 Child Protection Working Group, made up of different agencies, UN, CSOs, and government, different government agencies that came together very quickly, and they started looking at COVID-19 from a child protection perspective. And as Madam Goretti has also mentioned, guidelines. So guidelines were developed, and this, I remember, we sat over a weekend, and this basically it was a push by CSOs after getting so many calls from parents. I'll just give an example. One of the calls that we got from a town in Kenya, that these parents have been tested positive, and they have 2 children. And then unfortunately, the dad of that family passed away. So, and the mom is in the isolation center, and they had three children. Yeah, 3 children. An older one who needed to work, and then 2 younger ones, a 15-year-old and a 2-year-old, who were in the house by themselves. So it was very sad that these children had been in the house for 3 days. They had been in the house for 3 days without any support, without anybody knowing, and we were getting calls on a weekend. And we didn't have any guidelines then of how do you take care of families, taking care of children beyond the medical area. And because health workers did not have that, how do you safeguard children when they are not sick, but their parents have been sick? How do we make sure that that separation does not happen? How do you ensure they are safeguarded, that they continue eating as their parents are in the 14 days isolation? So those guidelines are in the process. They're in advanced stage of being developed. I think they're waiting to be signed off by the PS. So, but we are hoping that now that the numbers have started going up again for COVID-19, and with an imminent closure, so they come to kick start. So, okay, my slides are not moving. However, okay, children officers are yet to become essential workers, resulting to slow rescue missions. So I will not talk badly about journalists because I'm one of them. As journalists, as cab drivers, as other people are becoming essential service workers, children officers were not put in that list, which really endangered the lives of children and put children really in a very serious challenge. Sorry, guys, I need to parent for 2 minutes. Just give me a second. I need. Okay, sorry, working from home means you have to parent at some time. So children officers are not, as I said, they're not essential workers, same as NGO workers. So that can make sure that there was an increase in sorry. So, for example, the increase in FGM, and there are not children officers who could go there. There was an increase in child marriage or teenage pregnancies, but children officers could not go because of they are restricted. Because if curfew time finds you there, you are in, like you're arrested, you know. So, and there has been an increase in child marriage and FGM. Like today, I'm in a group and we are discussing about these issues that now the schools have opened, girls are missing. Okay, that's something we expected, but not at this proportion. There's one school actually just near where I am right now. Out of a class of 50, 10 are missing. That's what percent? Almost 25% of the girls are missing. FGM, this is now an open secret. The other day, it was on TV, a whole ceremony in town of girls being cut, you know, and it is open. Okay, for teenage pregnancies, you see, I put a question mark. As much as there's what's saying teenage pregnancies have increased, but the evidence shows the numbers are much lower than last year. But we could have done better than making these girls get pregnant. So a worrying trend is online abuse, grooming, trafficking, and exploitation. All of us, like in Kenya, there's this very sad case of a girl who was going back to school. And then because she was being groomed for 6 months by this quote unquote teacher, she finds herself moved from Nairobi to Western Kenya, you know, and so she becomes a multiple kind of case. She becomes a missing child. She becomes an online abused child. She becomes a trafficked child. She becomes a sexually exploited child. So you can see, and that is because she was online. And we have had cases of where classes were Zoom bombed, classes where and children were forced to view very bad materials. So, and that's something that it's working. It's something I think nobody foresaw it, but I'm hoping now, as we are advocating for stronger legal framework on online protection, and I know the government of Kenya is developing materials, and right now I think they're developing a guideline on online child protection. It will include some of these things that we did not think were coming, considering that online use has gone up by 1,000% in the last 6 months. So it will be important to see what government is going to do with this new phenomenon. So on, okay, I hope I've not skipped any. On child development, remote learning, planning, it's not learning on TV and radio and online, like on online platforms. The government did an amazing job coming up with content very quickly and putting it online, having TV schools. I know of a girl who, unfortunately for her, she has been doing that, and now they are being forced to do exams this week. She's prepared, but she's been on TV watching that the whole time, and then on radio for schools which are very remote, and then online itself. There are many platforms that have come up. Some of them are government sponsored, that are there for children to be able to learn. And then school reopening for final year students. I know I had a discussion, Yvonne will know this. We had a discussion when this Kenya government said that they have cancelled 2020 calendar year. And there's a whole discussion about, did they think about children? They cannot cancel a whole year of schooling. So they kind of heard that you can't cancel a whole year for school. It's going to pull back a lot of children behind. So, and they have opened finally for final year. That's grade 4s, standard 8s, and form 4s. So they are able to go back. That's for basic education. They are able to go back and at least to reclaim the year and be able to see if they're going to finish their school, their current level, at least by March. However, again, screen move. However, access to online learning platform is limited. Okay, not every child could access internet, okay, or gadgets. So they could have, like, I have had cases where you tell the children, I'm going to buy for you bundles, but they say, yes, thank you, miss, but if you buy for me internet, but I don't have a gadget, you know. So where internet is available because there are balloons that were put all over the country, but the children cannot afford the gadgets, okay? A lot of children may not go back for various reasons. This includes economic reasons. Parents, there are those ones who ate school fees, but there are those ones because of the hardship resulting to COVID-19, they have lost jobs, they have lost their source of income, and so they are not able to access, they cannot be able to pay school fees for their children. So they're not going to be able to go back. Social reasons. Someone was 17 or 18, now they are 19. Now going back to school, and I'm in Form 1 or Form 2 or Form 3, they thought there was hope. They think I'm too old to go back to school. I am like, I don't think I can be able to do this. And also social pressure, like child marriage, as we say, child marriage is on the increase. Because of that social pressure, school is gone. You are told school will better your life, but school is gone. So because of social reasons, they have been pressured that they're not going to go back to school. Health reasons, COVID-19 itself, but also because of fear of getting COVID-19. There are parents who are not going to take their schools back because what the numbers are saying, they are on the increase. Why should I take my child back so they can go and get corona? No, there's no way you're going that. On right to survival and survival. Yes, this school closure to safeguard the health of children, health information dissemination for children to know more about corona, child-friendly isolation center. This is one of the best, I think one of the best things government done. I think it is the only one I have read so far. In Mombasa, they created an isolation center for children. It had toys, well-painted, all cute, social workers who have been trained to work with children. So children did not have to get shocked that they are being isolated. So they were isolated and parents were allowed to come and see them. So and I think it's still ongoing. Dr. Nzenge, or Mr. Zenge, down there, he's doing an amazing job. Age disaggregated data. So this is after we made a lot of noise as civil society organizations that the government is not doing enough on issues to do with data, and why are they just giving data for adults or female and male, but they're not giving for children? Because you'd want to know what are the advocacy issues that are around, what are the issues that are there that you can be able to advocate for children. And they actually badged in, I think 3 months later, and they started giving the data for children, how many children below the age of 18, below the age of 13, and below the age of 3. So that way we can be able to know what needs to be done. Child participation. Fortunately, children have been engaged over the last is it 6, how many months now? 6 or 7 months on the online space. Total News has partnered with the Department of Children's Services and the National Council of Children's National Council for Children's Services in hosting virtual forums, and we have held like almost once per month. We engage children on different topics, and one of the forums we actually children engage the committee, the Sarah Ruto committee, the special committee on COVID and education, and we saw some of the recommendations by children taken up, and they were in the report, which is a plus. It's one thing engaging children; it's another having their views being taken in consideration. So some of these things were taken into consideration by the Sarah Ruto committee. Day of the African Child, and this was a very tricky one because Day of the African Child for this year, it was children in the juvenile justice system. And the fact that the government had closed all institutions, there was no having anybody from outside going in. We had to get very innovative on ensuring that children in the institutions actually get their views heard. And we got to have like about 3 or 4 forums with these children, and they got their views heard, not only in Kenya, but at the AU level, which for us, I think it was a big plus. Again, however, our children in rural areas were left behind. This bites my heart every time when I think about it, because as much as you'd want children to participate, it's virtually, but not all children can be able to access, as I said earlier, can be able to access can access they're called gadgets or internet. So that means they want to speak, but they will not be able to do that. So that means we need to be more innovative on that. One of the things I think we have tried is, after the restrictions were a bit better, is to have the children go to the Department of Children's Services and use the internet in the Department of Children's Services office and the gadgets there. But now if it closes again, I don't know what's going to happen. But for now, I think what we are working is just having the children go to the Department of Children's Service office for them to work. And that was an initiative by DCS and a few CSOs thinking we need to engage children in rural areas. The news is not child-friendly. Children end up eating up news from their parents. So this is a comment from a child. A child asked us in one of the forums, when these guys are giving their updates and telling us about, and giving us about the big numbers and use words like code of circular, I don't know, something. Do they think that we don't want to understand what that is? Or, and it made so much sense that, and for them to understand, I have to watch news, understand it, and then I have to explain to my child. And you find like most of the time, children are getting second or third level information, and it can be distorted. It can be fake news. Remember that time he was saying you have to breathe and hold for 20 seconds to know that you have corona. If you had a cough and then you cough out before the 20 seconds are over, you go like, man, I have corona. But your parent told you that to hold, if you cough before 20 seconds, you have corona. So that was a challenge. So that is the end of my presentation on issues to do with COVID-19 and child rights and some of the opportunities that are there. Sorry, I don't have corona though. So I hope I've answered the question. If there are any questions, I'm willing to respond to them. Thank you so much.
Thank you so much, Jennifer. Definitely some perspectives that we will definitely benefit from as we are beefing up the research. So we're going to open up the floor for some discussions, particularly around some of the views we're getting around the status of implementation of the EAC, both at regional level and also at national level. John, I've been seeing quite a number of questions around whether policy priority 1 and 9 are similar, and also some questions you have for the government of Kenya around the ratification of the Niamey Convention from the African Union on cross-border cooperation. And then we also have Stephen, who's also reflecting on whether there are opportunities for learning, and then Ben also reflecting on whether internet could also be cascaded to the informal settlements. So we'll open the floor for about 15 minutes and then dedicate another maybe 10 minutes for one more question we have as the consultants around some of the data gaps we have. So John, I would like to give you this opportunity to maybe reflect on some of the discussions we've been having, and then you can also ask the questions to the various presenters so that we can zero in on some of the key issues we need to highlight in the research. Over to you, John, and then shortly after John, we'll have Stephen and then Ben Omilo. Hi, Dr. Njoka. All right, he says he's not able to talk. His mic is bad. But perhaps, Madame Mary Goret, thank you so much for the presentation. And there was a question around the ratification of the AU Niamey Convention, although it's not one of the key international instruments against the EAC Child Policy Monitoring and Evaluation Framework. Perhaps we can reflect on the status of ratification of that instrument, and also trying to understand where alternative childcare falls under between policy priority 8 and 1 and 9. So Maurice, maybe you can answer the question around the similarities on priority 1 and 9, and then Madam Mary Goret can maybe reflect on the issue around ratification to give effect to cross-border collaboration, and also looking into the resourcing of the implementation of the EAC child policy. And then we'll move on to Stephen to ask his question. Maurice, over to you.
Yes, thanks, Yvonne. So the two priority areas, and as I stated from the beginning, most of the priority areas are related, where you find one priority area just implements the other. So while priority area 1 seeks to develop a regional approach to ratification, domestication, and implementation of international instruments, priority area 9, just a second. Yeah, sorry. So priority area 9 is just a mechanism for monitoring both the process of ratification, domestication, but also any other programming around child rights in the region. So, so the priority area 9 mainly looks at monitoring, evaluation, but also goes to encourage partner states to consistently report on the progress they are making in policy application at national level, but also how they respond to the EAC child policy across the different priority areas. So I don't think they are related, only that one operationalizes the other. Over.
Thanks, Maurice. John, I hope you are answered regarding the differences. Then, Madame Mary Goret, perhaps you could help us just to reflect on the issue of ratification of the Niamey Convention, but also to hear that the optional protocols are considered as current legislation. Is there a plan to eventually ratify them? And also the issue around the violence against children study that was conducted by Kenya. There's also a request that the data out of the research and the study that was conducted in 2019, whether it can be disaggregated for CSO's uptake. So, Madam, do you perhaps have any reflections on that before we also open the floor for other colleagues?
Hello, yes. Thank you very much, Yvonne and John Joka, for the questions. On the issue of the AU Niamey Convention, I have no information whether we have ratified, so it's something I need to check up with the treaty division of the AG's office. And generally on ratification of conventions and protocols, according to our constitution, any protocol that we ratify becomes part of our Kenyan law. So there is now a very elaborate procedure of ratification because of that provision. So there is a whole division that looks at all the treaties and conventions and protocols so that the country is ratifying what it can use. That's what I want to say about that. There was also a question on the 2019 VAC study that this document is available online. It has disaggregated data. Unless Joka has some specific data that he requires, then maybe we can see if it is not available there. But all the variables, the indicators that were surveyed, they have been analyzed and they are in the report. Okay. Now, on there was also an issue of birth registration for minorities and refugees. As I said in the presentation, any child born in Kenya should be given a birth certificate. And it is clearly stated in that birth certificate that that is not proof of citizenship. So there should not be an issue of a child not having a birth certificate, because that does not denote that that is a Kenyan child. Now, I can see what Joka is saying, that the VAC data is not disaggregated by county. Yes, it is not disaggregated by county because it was a national survey. So you will not find any county disaggregated data in that survey. It was supposed to measure violence in the country, not in the counties. Then just to comment on FGM, when there is a project that is being, there is a project, and the anti-FGM board, which is interministerial. It has just been initiated during COVID, when we realized that most children are being cut or falling into child marriage. So there is a committee that is going out to the counties, sensitizing community members. It started last month in September, and the program is going up to December. And they've been to various communities where FGM is rampant. So there's already something that is happening. I also saw that Njoka was raising issues of life skills. The government actually tried to introduce life skills training by using the teachers in the communities, but one of our citizens, and that is why we were not able to provide life skills. Yvonne, I don't know whether I've responded to all the issues. Kindly remind me what I've not touched on.
Yes, sure. I think you've comprehensively touched upon most of the issues. Although there's one from Ben Omilo around child protection systems, and also linking the access to internet for informal and rural areas, as a lot of children are also left down. So Ben Omilo was proposing that county governments should also look into internet connectivity, especially for children in rural areas. Yeah, so I think that was more of a recommendation.
Okay, yeah, I saw it and I picked it as a recommendation on how we can work with county governments to ensure that there is internet connectivity. But as Jennifer was saying, the internet might be there, but the devices might not be available. And that's why we are using our offices. But our offices are at the sub-county level, so only a number of children can access. So that challenge is still there. Thank you.
Thank you, Madam Mary Goret. Then we have Stephen. Would you like to take the floor just to give us a few of your reflections before we also widen it up to other colleagues? Stephen, your questions or comments?
Yeah, thank you, Yvonne, for the opportunity. Mine just few questions. One is whether there is an opportunity for us to review these priorities. Because my understanding, I mean, it's been, this document has been with us for quite some time, but I'm not so sure whether we have some timelines, especially in regard to the frameworks that have been mentioned, as well as these priorities being looked at again in the face of the evolving issues. And then the other question is on, or mentioned, is actually children in alternative care, because across the region we actually saw that most of the children who are in institutions were abruptly taken back to families and communities, and there have been some significant learnings because almost half of the children in the institutions in Kenya were taken back to their families and communities. Contrary to the popular view that all these children do not have relatives or do not have family members. So I'm just curious to know, with these kind of learnings, what is the government doing to prevent these children being reinstitutionalized, taken back to these children's homes or children's centers, orphanages, whatever they are called. The steps that the government is taking to prevent these children going back to the institutions, but also because in one of the meetings that I attended, it came out clearly that even the children who are left in the institutions, many of them are there illegally because they don't have even commit orders from the government. So I think those are just the two from my end.
Thank you, Stephen. Maurice, would you like to take the first one around the revision of the policy priority areas? And then Madam Mary Goret can maybe reflect on the issue on children in alternative care in Kenya. Maurice, over.
Yes, the child policy itself is subject to revision after every 5 years. So if the partner states wish that there should be a revision, I think there can be a request made through the sector council that deals with children affairs for such a revision to happen. But the way the child policy was drafted and its resultant action plan is that it's quite broad, and as you implement, you can revise the action plan instead of the child policy itself, because once you read that document, the child policy is broad. In most of the priority areas, it goes as broad as possible. Then the specifics are in the action plan. So in order not to over-revise or to keep going back to the child policy, we got leeway to draft an all-encompassing action plan, which we can also build on through different frameworks. So beyond the child policy, we have other frameworks which are being developed out of the child policy. For example, the framework for strengthening child protection systems further expands the child policy. So if an issue falls in the area of child protection, you can easily address it in another framework that probably the mother policy did not address. Some of the issues which are directly linked to which might be very urgent can also be addressed when we reach a conversation on legal mechanisms, because it's our hope that at some point we shall have a regional law on children, and maybe that's where we can have some of the areas which might need legislation addressed in that law. But otherwise, policy is a working document which can be implemented in response to different contexts, to any prevailing situations, any new and upcoming challenges. So I think even without revising the child policy, we can still implement some of those new and uprising issues that probably might be coming up in the region. So that's how I can respond to the question, and I hope that that responds to Stephen's question. Over.
Thank you so much, Maurice. Madam Mary, perhaps you could then take on the issue of children on alternative care.
Yes, thank you, Yvonne. Thank you, Stephen, for that question. It is true that the children that were in institutions were abruptly taken back to families. I think COVID was an emergency to all of us, and most people didn't know what could happen. And to me, I always say it was a blessing in disguise for those children, because we were able to reunite or place children in alternative family care. Over 2,000 children were moved from institutions to families. And though it was not done in a very organized way, what followed up was very well organized, because there has been support. The department was involved in the exercise under the care reform program, and our children officers have been supporting the children with the psychosocial support, and our partners, including some that I'm seeing on this call, Catholic Relief Services and Changing the Way We Care program, has been providing assistance to the families that took the children, both biological families and the alternative families. So they are being supported with the food supplies, and officers keep monitoring how the children are fitting in. So it's an area that we are keenly following, because we removed children not only from the charitable children institutions, but also from the government institutions, the statutory children institutions. And we have that program that we are working on now of care reforms, trying to move children from institutions to families. So thank you very much.
Thank you so much, Mary. Maurice, I understand that you also have a follow-up question around children who do not have families at all in terms of where they are now. So, Mary, is there a move by the government of Kenya to move away from institutionalization, and what is the strategy that the government is putting in place to ensure that children who do not have families actually do not end up in institutions? Is there any strategy in place by the government of Kenya?
Yes, this is a program we had started before COVID of care reform through the institutionalization and getting families for children without families. And COVID just came to hasten. But the point we are at right now is that we are working on a care reform strategy guided by the National Council for Children's Services, working with partners. And now that strategy will show us how to do this. We already have some counties that are piloting, Kisumu, Kiambu, Kilifi, Murang'a, Nyamira. They are piloting alternative family care, getting families for children who do not have families at all. We understand that it is not going to be an easy process, so we are not saying that we can do this so immediate, but we have started the initial steps. So we are learning from these counties so that when we upscale to the whole country, we hope that we will, in I don't know whether it's 10 or 20 years, do away with the institutional care. So that is something we are very keen on, and I don't know whether who is it? Cornell is still on the call. Maybe he can add more. He is part of the care reform process. Thank you.
Okay. Thank you, Madam Margaret. Colleagues, I'm cognizant of the fact that we are 10 minutes to the top of the hour, but perhaps if we can request, if we can go above 4 o'clock my time, which is 5, and we end at 10 past 5. We promise not to keep you longer than 10 minutes after 5. So, Benedict, you also asked a very pertinent question around awareness and knowledge of the EAC policy. And as consultants, we also noticed that none of the plans or strategies that have been reviewed or that have been developed post-2016 acknowledges or refers to the EAC child policy. We find that all the 6 partner states, including Kenya, do give cognizance to other international and regional instruments, but with very little acknowledgement of the EAC child policy. So we might want to hear from colleagues why is it or is it a matter that the EAC child policy is not well known, or it has no place where it's considered the implementation role of a certain government entity. What could be the reason that very few governments, or particularly Kenya, has been acknowledging the plans and strategies? And then just as a follow-up question for us to reflect maybe for the next 9 minutes is, as CSOs and governments and academia working in Kenya, is the EAC policy relevant to the child rights response in Kenya, whether it's serving any purpose in order to mainstream national planning and implementation of other instruments that the government of Kenya has ratified. So why don't we know about the EAC policy, as Benedict has highlighted in the comments, and is it serving any purpose? It would be good for us to hear from colleagues. And Kata, any reviews? I can also see Lorna, Ruth, Gachanja. It would be really nice to hear from you, Joseph, Gitu, and also Frashia. Some few reflections on where we are with acknowledging the EAC child policy in plans and strategies in Kenya. So, any takers?
Okay, Yvonne, can I start, Jennifer?
Yes, sure. Yes, sure.
So my thinking why the EAC policy uptake has been slow is because of the EAC itself. There's a view that the Jumuiya is not as Jumuiya as it is. It's not a strong component. Even as much as we sing the national anthem, you don't feel the EAC, the community itself in our structures, in our system. And I think that, and knowing children issues are never a priority anywhere. So that makes the EAC policy not very, very strong. So I think that's one of the biggest challenges. That's why it is not known. And so compared to, like, for example, even the charter itself, it's struggling to be known compared to the UNCRC and other treaties, regional kind of policies. I think the EAC is because of the EAC itself, not because of the policy, it's because of the structure of the EAC itself. You can strengthen the EAC structure itself. It will ensure, it will cascade, or it will have a ripple effect on other policy, including the EAC child policy. That's my take.
Thanks, Jenny. Any additional reflections from colleagues?
Hi, everyone.
Hello.
Hi, Yvonne. My take would be, I think it is the process of the dissemination at the grassroots level. That's how I think why the EAC policy is not popular.
It's a question of dissemination as well, to ensure that it's not only national but also decentralized. But maybe as we try to unpack, but is the policy relevant? Are we seeing it as a relevant document in child rights response in Kenya? Does it serve any purpose in terms of national planning and implementation at national level?
Yes, Yvonne, I see Fresh's hand, but I wanted to come in very quickly, probably just as a follow-up question, because this question, it is an observation which has been made in all partner states, and it's a question which we've asked in all FGDs, and different responses have been given, but also some of the responses, especially on dissemination, have been the common reasons. So, but I remember in Tanzania, we went deeper on this, and we even wanted to probably interrogate this question even more, because how then do other treaty bodies do it different? Who, for example, popularizes the UNCRC, and why don't we have the same structure in the EAC? Who popularizes the African Charter, and why don't we have the same structure at regional level? EAC, we know that each of the countries has a ministry responsible for EAC affairs in the different partner states. So what role do they play in making sure that EAC programs and policies cascade to all levels at national level? Then I also raised a question to the donors, the development partners, the funders. If you support the EAC in certain programmatic areas, but again you go and support the same programmatic areas at national level, and then you support the same programmatic areas at continental level, then to you, in form of accountability, how do you have these checks and balances to make sure that there is no duplication? Because otherwise you're just throwing resources to the same areas, but you're not also checking where your money is going. So I think it's a systemic issue. And I think for me, from the regional perspective, I think partner states, countries pick and choose. They pick what to front best and what to leave out next. Because even as they do their reports, to the on the UNCRC and on the Charter, do they really go back and reference regional policies? Especially, I would want to read all the reports, especially which have been made post-2016, because the AU recognizes RECs as arms of the continental body. But how then do the member states who are member to these RECs also recognize the policies made at REC level? So I think it's a systemic issue, and it's something that we need more discussion on across the board. Over.
Thanks, Maurice, for those good reflections. Fasha, do you want to add in anything before we move to the next issue? Fasha, then Joseph, then we'll close for now.
Okay, thanks, Yvonne. It's interesting, actually, the question that you have posed, because we've worked quite for some time with Maurice. But when we look at the questions he's asking, why is the other policies like the UNCRC and the African Charter a bit more popular compared to the regional policy or this policy, the child policy, the EAC? I think in my experience, or having tried to popularize this, my experience, something else that has been mentioned, I think it was Lorna, it's how you disseminate. One of the things I've realized is that the EAC ministry, a lot of child rights organizations and networks do not engage with the EAC, the Ministry of EAC, as much as the Ministry of EAC is there. When it comes to child rights issues, most civil societies tend to engage with the Department of Children's Services or the ministry that is directly engaged with child rights issues. I am seeing George is present, and I'm not so sure even for them how many child rights policies they have or child rights activities that are geared. When we talk about the EAC, most of us look at it in terms of the trade, the rec aspect of it, the trade and the others. So even the way the EAC is structured, I guess also presents a challenge, because if you want to engage with the EAC as a civil society, you have to go through the national dialogue process, which again, you go through the East African civil, the EACSOF, which again is a civil society in itself. You join the membership. Then when you're getting through that entire process all the way to the Secretary General Forum, again, there's so many competing issues, because all civil societies, even trade, all this manner of issues, all of them are highlighted at the same venue, or let me say the same. So it sort of gives, then child rights, as Jennifer has noted, child rights then does not gain priority. Every time we have, even when you look at the theme that comes out from the EAC, it's always something geared towards industrialization. Then the rest of us have to figure out, how does child rights fit into that thematic issue? So when you compare the policy itself vis-a-vis the committee or the UNCRC, both of these policies come with a review mechanism. They have an obligation to the state in terms of how to report, how to monitor, and there's a various methods of engagement, which is not necessarily the case with the policy. How we engage, so it's not, I guess there's a myriad of issues, I guess, in terms of engaging with the RECs. As much as the AU engages with the RECs, or the AU recognizes the RECs, I think in terms of how we engage with the EAC, and even in terms of this policy, I guess the fact that we are not doing reports to the EAC, then it becomes, well, it's not a challenge, because then governments tend to put resources where there's something that they're expected to do. I think even for the charter, as Jennifer has noted, it has taken quite some time for us to give the usual periodic reports, wait for the concluding observations, and actually take the decisions that are coming from the committee. So I think the fact that it's a combination of a lot of issues. One, the fact that it's not as popular a policy. So I'm sure Maurice has said he would like to see the reports that are being written to the committee. I know, having participated in the Kenyan report to the African Charter, the EAC policy wasn't really mentioned as such. I guess it's also because when we are reporting on the country, when we are reporting to these charters, we report on the country-based aspect of it. Kenya as a country, what has been happening in Kenya as a country. We really, the cross-border aspect issue rarely comes out in a lot of these reports. So that in itself provides a gap, because this policy, it's not just looking at one country, it's looking at the EAC region as a whole. So I don't think we can say there's one specific factor, maybe as Maurice has highlighted. I think this is something that would really require a lot of, or maybe for us to really dig in and ask ourselves, why isn't it as popular? But in my experience, those are the reasons or a bit of the issues that I have encountered why the policy isn't as utilized or as popular as the Charter and the UNCRC.
Okay, thanks, Prashia, for that detailed explanation. And I think there is also a colleague who's just been off, Ruth Gachanja, who also agrees that it's important to maybe have an analysis of the funding aspect of the policy from both the EAC Secretariat down to the partner state, and then linking it also with accountability and monitoring mechanisms with the UN and AU. Joseph, I'm cognizant of the time, so I'll give you 1 minute, or actually 45 seconds, and then Divina also have 45 seconds, so we can start wrapping up. Cornell, I'm sorry, I might have to also just ask you to give us another quick 45 seconds, and then we can start discussing on the next steps. So Joseph, Divina, and then Cornell. Thanks.
Thank you. I hope you can hear me.
Yes, sure, loud and clear.
Yeah, this is Joseph. I'm talking from Nairobi, and while it's true that the policy is relevant to child rights and protection, but I think we may need a deliberate effort to ensure that we have some structures in place that will support the implementation of the policy. Our Madame Mary Goretti has admitted that we have challenges in terms of financing and human resource, and I think this is the high time we deliberately plan for that and ensure that we have resources to support the implementation of the policy, as well as the team to support that structure. I was thinking about Kenya, where we have the 47 counties, and in each county we have the EAC, we have the LACS that supports the implementation of such policies on children at the grassroots level. And I think to start with, we may have to have some task force to ensure that the policy is well sensitized at the county level through the Area Advisory Council at the county level. I'm assuming this is a project where we need to have some kind of planning, deliberate efforts to plan at the initial structures of the government. We have to ensure that it's implemented within the plan. We have to ensure there is sort of monitoring and evaluation. We have to report to the EAC. Unless these structures are put in place, I think the policy may be there, but not known. So from where I sit, being in urban area, I think it's high time for the EAC to have a deliberate effort to have some structures that will support the sensitization at the grassroots level. Thank you.
Thanks, Joseph. Divina?
Hello, everybody. My name is Divina James from Kenya. I would like to agree with all those who have contributed to why the policy is not taken as the way it was supposed to be. But my input is, it is from 2016 to date, it's like 4 years. It's still very, the time is that short compared to put it into the comparison with the African Charter and the UNCRC. But also, it will be of benefit for the policy implementers to learn from those two parties, the UNCRC and the African Charter, to see the journey they've taken to reach where they are today. And also for me, the issues of financing and also accountability of that great importance when we want to move on with the East African child policy. As we also think of reviewing the policy, we need to really research and learn from those areas. Thank you.
Thanks, Divina. Cornell, and then Kata, and we'll close with some reflections from Madame Mary Goret. Over to you, Cornell.
Thank you very much, Madame Yvonne. My name is Cornell Ogutu from Catholic Relief Services, Changing the Way We Care, and we work very closely with the government of Kenya on matters of care reform. And Madam Goretti has really sent the point straight home on matters of care reform. And the care reform strategy for Kenya is really the in thing, where we have prioritized matters. And I just want us to look at it not from an isolation perspective, that the care reform strategy is also heavily borrowing from other documents, including the system strengthening approach to child protection. So these are really speaking to other documents. And we are proud that the government is really taking the bull by its horn in taking the reform agenda forward and also integrating other components. Otherwise, the major areas that you are looking at are the development of those important guidelines like the case management for integration package, as well as gatekeeping guidelines. So all these are informing the work that we are seeing, that I'm seeing the big relationship between care reform and the policy that we are looking at. Thank you, and over.
Thanks, Colonel. Kata, over to you for your reflections.
Thank you, Yvonne. Thanks, colleagues. I'll be very brief. I think the question was whether comparing the policy to the EAC, to the charter in the CRC, why it doesn't seem to have taken or there isn't equivalent traction, whether in Kenya or the other countries. And my immediate reflection is perhaps we are using the wrong metrics of assessment. I'm just being the devil's advocate, but I do think that there might be some room for us to look at exactly what are we evaluating the policy against in that regard, because the policy doesn't create any new obligations. The policy is there to actually give effect to the CRC and the African Children's Charter within the EAC member states. And if that's the case, then the purpose of the policy is different from those two. So you shouldn't really expect that the manner in which states approach the implementation of those two would be the same as the policy. So I would think that in the same manner, rather than, learn a few things from what the states say, from what the states do in relation to the CRC and the African Children's Charter, that's fine. And also look at how those two mechanisms have done it. But I think that in as far as the EAC child policy is a policy, and that means it has a different regime of operation, particularly in terms of state obligations, I think we and a tailored criteria of how success looks like for a policy. It doesn't look the same for a treaty. In the simplest form of how I would put this is just say that the policy cannot take the place of a treaty, and so we shouldn't have the same expectations of how states respond to it. And so that's just my view, that it's very hard for me to elaborate, in detail in the time that we have, but I do think that there is need for different thinking of how we assess whether states are taking it in equal measure or in equal seriousness. In fact, they shouldn't, because those are two different documents. But I agree. There are some levels of convergence, but we should just be conscious of, in the first place, what is the primary role of the policy that is not the Charter or the CRC. Thanks.
No, thanks, Nkata. I think it's good that you're playing the devil's advocate, so we create that balance on states' expectations around accountability to all the three child-related instruments and other instruments as well. So I think that will be an analysis Alfred and I can also include and maybe come up with a recommendation for the EAC Secretariat. So colleagues, we are almost quarter past the hour. I would like to maybe take this opportunity to give a minute to Madam Mary Goret just to tie up with a few reflections. And maybe in the reflections, Madam Mary Goret, there was also a question around the status of the review of the current Children's Act. And then we'll hand it over to Maurice. And also I'll just ask Alfred if he has one or two remarks before we close. And then we end it with Maurice. So, Madam Mary Goret, over to you for just some quick reflections on the discussions, and then we'll move over to Alfred and Maurice.
Okay, thank you. I agree with Nkata that we should not treat the policy as their treaties. And to me, the most important aspect of this policy is cross-border collaboration. So if we get that right, then the rest will fall into place. And the EAC should be able to whip its members to implement this policy and other child-related documents, because we've developed some few of them. So we really need to have children issues take some center stage in the EAC, because right now I think it is somewhere in the periphery. Related to that is the structure of the EAC itself. So I think Maurice and team need to really look at those issues. I don't think I have anything else to say, just to say that as a country, we are always ready for such reflections, because when we get to be asked questions on our progress, our challenges, we are able to double our efforts and provide better services for children. So we really hope that this report will come out with recommendations that we can put into good use as a country. So thank you very much, Yvonne.